class. My name is Angelica Gavaglanian, and my presentation for today is about bone marrow transplant. Let's first start off by understanding what bone marrow is. Bone marrow is a spongy tissue that is located in the center of any bones in our body. In this tissue, it is where white blood cells, red blood cells, and platelets are produced. Another name for bone marrow transplant is stem cell transplant, and it is a procedure that is done when their body begins to stop producing healthy blood cells. On the left-hand side, we have a picture that is more zoomed in on how we can see the bone marrow, the red blood cells, the blood stem cells, the white blood cells, and what the doctors are actually looking for during a transplant and how deep they go into the bone to retrieve it. So this is a continuation of the first slide, and there are actually two types of transplants. And one of them is called the allogenic stem cell transplant using cells from a donor. And then the autologous stem cell transplant, which is using cells from your own body. The bone marrow transplant has been a big benefit to people that are diagnosed with malignant, cancerous, or benign non-cancerous diseases. And there are a lot of diseases that it has actually been beneficial for these patients, and some of them are acute leukemia, bone marrow failure syndromes, chronic leukemia, and we have the plasma cell disorders as well as one of them that it has helped patients. Why is the transplant done? So the bone marrow transplant is used to safely allow treatment of a certain condition with high doses of chemotherapy or radiation by replacing or rescuing the bone marrow damaged by the treatment. It replaces diseased or damaged marrow with new stem cells, and it provides new stem cells which can help kill cancer directly. And the recovery process is 2 to 6 weeks, and it does involve frequent hospital visits after surgery just because it is such a serious surgery done that you will never know how the patient will react after surgery. So doctors need to keep an eye out for that. And then as you can see on the right-hand side, we do have a little child that is getting surgery done, and it shows what position they put the patients in for surgery and how the needle goes in to retrieve the bone marrow. So there are many risks for the bone marrow transplant, and it is very different from patient to patient. After surgery, some patients are able to recover and have minimal problems, while there are other patients that experience so many complications that it puts their life at risk. And the risks come from how severe the disease is and the condition that the patient is in. And also overall age and health does matter, and it is very important. Complications from transplant surgery can be graft versus host disease, which only can occur from allogenic transplants, only stem cell graft failure, organ damage, infections, cataracts, infertility, new cancers, and even death. So why did I end up choosing this topic to talk about to you all today? Well, for one of my classes, we had a discussion to write about a certain TED Talk that was done by Daniel Graft, where he talks about a better way to harvest bone marrow with a new technique that they have found. And it is using a certain machine that was shown in previous of my pictures. Instead of doctors having to do so much work going back and forth to retrieve the bone marrow fluids, they actually use that certain needle-like machine in order to remove it, and it is safer for the patients and the doctors as well to properly perform this surgery. And this video does show that medicine is changing every single day, and new inventions are being created. Even though this video is old, it still inspires students, and it definitely inspired me to be dedicated to study medicine and to make a change in the world by making a difference in someone's life. Thank you so much. And here are my references.